Cancer. Unfortunately, many men get their breast cancer diagnosis rather late, owing to many factors such as their physique and stigma. Ray Polo now brings you the story of Steve Ouda, a male breast cancer warrior who was plagued by perennial misdiagnosis until a nurse picked it up by chance.
A small pimple that is spotted on his right nipple in 1993 would stay benign and painless for years. As he grew older, the pimple also kept growing silently, but later on mutated to become a nagging wound. Steve Ouda says he made several trips to local health facilities in Siaya, but none suggested that he carry out cancer screening. Meanwhile, the wound was growing as he desperately relied on painkillers and periodic bandage dressing. The swelling bills pushed him out of hospital. Home care was not any better under an aging and ailing mother. Ouda returned to hospital, and that brought him relief in many ways. He met an oncology nurse who was on a cancer outreach mission in Siaya. That is when Ouda was diagnosed with breast cancer more than 3 years after his wound began to mutate.
He came to Eldoret and we picked it up from there, diagnosed him, took him for surgery and then put him up for chemotherapy.
Chemotherapy ilinyoa nywele yote na sikuwa nimeenda kwa kinyozi. Makucha ilikuwa inabadilisha inakuwa nyeusi. Sasa hapo baadaye zikaanza kumea, kucha pia ikaanza kurudi mzuri.
Dr. Primas Ochieng explains why screening for breast cancer in men is often not a priority.
Men generally are poor in health seeking. And also because of the fact that these cases are very few, men hardly are encouraged to go for the screening.
Breast cancer mostly is referred to as a women disease. So because of that, most men do not even take more extra care in maybe checking their breasts and things like that.
Lack of medical training and exposure to cancer cases may also limit healthcare providers from recognizing and or referring cancer patients to appropriate Medicare.
I've known a man who has had breast cancer sitting there for long and he was being treated as a wound. And what the doctor told him is that we think you had a bee sting or an insect sting or something like that, and that's why you got a wound in your breast, so we'll just keep dressing it.
Technology also presents gaps.
Mammogram was designed in a way that it can be able to check breast of a woman. So it was designed that because the breast of a woman is big, it can lie between two plates and it can be compressed, and then we can be able to see the tissues there. So routinely we don't screen men. It will be very uncomfortable, very difficult to actually do that.
As a result, some ignorantly settle for home care.
And that alone, that wound sitting there and smelling, can really interfere with the one's ego.
Steve Ouda tasted the bitter pill of stigma.
Ugonjwa ilikuwa ishakuwa imeoza, mpaka ilikuwa inatoa uzaa, mpaka magoti ilikuwa inatoka ndani. Sasa nikikaa karibu na watu walikuwa natoka. Sasa nabaki hapo peke yangu.
He found acceptance and care when the International Cancer Institute booked him in at their Eldoret facility. The organization catered for his surgery and upkeep during the treatment.
We assess them through our compassionate program, then we enroll them for NHIF. So as we process the diagnosis, the NHIF also matures. When the process of diagnosis is through, we start them on treatment. The first 2 cycles we cover under the compassionate program.
Nikapona hadi wa leo. Sasa mimi nashukuru Mungu kwa kunipatia uzima, na sikujua kama nitapona, nilijua nitakuwa maiti.
Some common symptoms of breast cancer in men include a lump or swelling in the breast, irritation or dimpling of breast skin, nipple discharge, pulling in of the nipple, or pain in the nipple area.
Men, they have less or fewer breast muscles. So when the cancer starts, it protrudes inside and affects the inner organ. So by the time it's being diagnosed, it has already spread to other organs, or it is already advanced. So it's very rare to diagnose men at stage 1 of the cancer.
The World Health Organization put the number of new cases of cancer in Kenya at over 42,000, with over 27,000 cancer-related deaths reported in the year 2020. According to the Global Cancer Observatory, Kenya recorded nearly 6,800 new cases of breast cancer in 2020, topping the list of new cases, followed by cervical cancer, prostate cancer, among others. That is why a sensitization drive toward early screening and treatment remains crucial. Breast cancer can be treated successfully when picked early. Although facilities like the National Health Insurance Fund can help to reduce some bills, the overall burden of cancer treatment often pushes patients to poverty.
Maybe your medical scheme can pay for you the hospital fee, but how are you transporting yourself there? How are you going to be accommodated there? And especially if you are referred for radiotherapy, where you are going to stay somewhere for even maybe 2 to 3 months.
Kabla ugonjwa inilemee, nilikuwa nanyoa, na sasa venye ugonjwa ilikuja ilibidi niuze vitu zangu za biashara zote.
As the sun sets over the sleepy Nyangweso village in Siaya County, Ouda opens his gate and his experience to men. He puts to use the only resources he has at hand, his voice, his time, and his journey to open the eyes of men to matters breast cancer. Steve Ouda is a cancer warrior who has survived to tell his tale. He's back to his village to fight what fought him most, social stigma. He's now rallying men to understand that breast cancer does not just affect women, that men too are vulnerable.
Ugonjwa matiti, seritani ya matiti inaweza shika hadi wanaume. Mimi ni mwanaume but ilinishika. Siku ipigia simu ikuje kwangu but nilistukia.
Ouda is one male voice that is supporting medics to convince men to show up for screening and treatment of breast cancer. Ray Polo, Citizen TV.